Maiam Talks நேயர்கள் அனைவருக்கும் வணக்கம். நான் மகாலட்சுமி. இன்னைக்கு நம்மளோட ப்ரோக்ராம் இங்கிலீஷ்ல இருக்க போது. ஏன்னா சிறப்பு விருந்தினர் இங்கிலீஷ் பேசக்கூடிய ஒரு மனிதர். அவரை நான் இங்கிலீஷ்ல இன்ட்ரோடியூஸ் பண்ணிடுறேன். Today with us is Professor Srinath Reddy. Welcome to Maiam Talks, sir. Thank you so much for joining us today. I'll first begin this show by doing a brief introduction about you. So, Professor Srinath Reddy is the president of the Public Health Foundation of India, and under his guidance, there have been 5 public institutes of public health opened to study various aspects of improving public health and infrastructure of our country. He is also headed the cardiology department in New Delhi, and he is also a visiting professor in multiple schools across the country, across the world. And most importantly, with regards to COVID-19, he's also a part of two important teams. One is the technical task force for COVID-19 by the government of India, and also the special committee formed by of the Human Rights Organization for the impacts of COVID-19 on human rights and the future response. So, first of all, we'd like to express our gratitude for joining us today, sir. I'm sure your schedule is quite packed with you being who you are, and with you agreeing to join us and share your knowledge with us, where we feel quite honored. Thank you so much, sir.
Thank you.
The stage is now yours. We'd like to listen to what you have, because since you are quite literally the front runner in handling COVID-19, we'd like to hear about your thoughts and your experience in handling this pandemic, and then we would like to proceed to the question and answer session, sir. So here, the stage is all yours.
Ellarukkum vanakkam. I do have a connection with Tamil Nadu and Chennai. I was born in Chennai. My mother did a MBBS and DGO in Madras Medical College. My father did his initial undergraduation in Annamalai University. So I partly belong to Tamil Nadu. But Tamil nalla pesa varadu. So you'll excuse me if I speak in English. Konjam theriyum nalla pesa varadu. So I'll get started. Basically, as far as COVID-19 is concerned, I think all of us are feeling challenged by this epidemic, which has assumed pandemic proportions across many countries in the world. We have seen fairly devastating effects in Europe and in the United States. China, where it all started, has suffered less, but it has also had a considerable amount of cases and deaths. And now we are seeing in other parts of the world, but we are particularly concerned about what is happening in India. And now we have crossed 1 million cases, and that is a matter of concern. But what is even a greater matter of concern is the fact that in the last 1 week, we have seen 21% of all the cases that have occurred in India so far have occurred in the last 1 week. And if you compare to the previous week, it's a 31% increase in the cases last week compared to the previous week. 16% of all the deaths so far have occurred in the last 1 week. So we are concerned about the pace of the epidemic, which is now marching ahead in many parts of India, though still confined largely in terms of damage to the larger cities and towns, and not yet entered the rural areas in any meaningful manner. But nevertheless, this is a matter of great concern, and we need to control it. Of course, we can derive some satisfaction from the fact that some of the absolute numbers that are being given in terms of how many million cases, more than million cases, and so many deaths are actually to be adjusted for the population size of India. Because different countries with different population sizes cannot be compared on absolute numbers. When we do that, we get about 840 cases per million, whereas in many parts of Europe and in the United States, they are in thousands. Similarly, in terms of deaths, we have 20.5 deaths per million as of now, whereas they are in several hundreds in Europe and the United States. This does not mean that we should be complacent, because we are worried about not only controlling the epidemic where it is now fairly severely felt, but also protecting the large areas in our country who have not been much affected so far, because if it happens to go there as well, then we are going to have much severe losses. So we have two tasks on hand. One is to put down the fires where they are in the big cities and towns, at the same time protect the smaller towns and the large areas of rural India that we have, where the virus has not yet made its presence felt as viciously as in the larger cities. So I will not go into the individual states. All of you are familiar with it and are reading daily. But certainly Maharashtra, Delhi, Tamil Nadu have been areas of concern, along with Gujarat and Madhya Pradesh. Now Andhra Pradesh is becoming a matter of concern in terms of increasing number of cases. Telangana has been a matter of concern. And Kerala, which was a success, has now started experiencing some cases, and Uttarakhand as well. So there are different states with different levels of the epidemic. But the question, of course, is why are we seeing lower death rates in India as compared to other cities, other countries rather? Now, there are different reasons that have been provided, but one of the things is because we have a much younger population. And because this virus tends to attack people who are usually in the older age group or who have other associated diseases like diabetes, hypertension, heart disease, respiratory disease, or people who are immunosuppressed because of cancer chemotherapy, that is where the virus has its maximum effect in terms of severe disease as well as in terms of deaths. Now, because our population is much younger, we do not see, we have only 10% of our population above 60 years of age, so we do not see the same level of risk. However, we are also seeing that, particularly in urban areas, but elsewhere too, that many of our people in the middle ages, even above the age of 35 years, have high rates of hypertension, diabetes, some degree of respiratory illness because of air pollution and smoking. So all of these other disorders that are there, which occur in the West at an older age, are occurring at a younger age in India, and therefore we are not totally protected by age. So that is one thing we must remember. But one other element is that we have a much larger rural population. And the rural population is much more protected because of two reasons. Firstly, the virus does not spread as fast as in urban areas because there are fewer people to move around with. And also, people in rural areas don't travel large distances. In urban areas, they are much more crowded and they also move around very fast and cover a lot of distance. So the virus can travel with them to a large number of people. Whereas in rural areas, the virus cannot really affect so many people at one time. So that is one protective factor. The second, of course, is rural areas have much more open spaces. And the virus actually tends to congregate and form what are called aerosols hanging out in the air in crowded areas, particularly indoor areas. And since much of the work in rural areas is done in the open rather than in closed office spaces, again, the virus doesn't get much of a chance to infect many people. So our rural areas are relatively safer, but it's our duty to keep it much safe that way. So it's very important from that point of view. In fact, when we looked at it last week, about 10 days ago, actually, 42% of our cases and 53% of the deaths came from 7 metros. Rural areas contributed very little. So we have a duty to protect our rural areas and our smaller towns because that is where our safety lies against the virus. Now, the other issue, of course, is how can you protect? Now, that becomes very important because the virus spreads principally through 3 gateways by which it enters the body. It enters the body through the nose, through the mouth, and even the eyes. Because people do not really talk much about the eyes, but the virus can actually enter the eyes. And even without causing conjunctivitis in the eye, the virus can slip through the duct, the tear duct, which connects the eyes and the nose. And then from the nose, it can spread into the respiratory tract and the lungs. Therefore, these are the 3 areas that we need to protect. And that's why the reason for wearing a mask to protect the nose and the mouth, and if possible, wearing glasses or some face shields to protect the eyes. And now the other question is, how do we actually do it? in terms of preventing the droplets from coming and reaching us. One is, of course, we wear the mask so that when we cough or sneeze, if we do, or even breathe deeply or speak loudly, then our droplets do not go and land on somebody else. But the same way, the droplets from somebody else should not land on us, so the other person also should wear a mask. So that is pretty important from that point of view. It becomes all the more important in crowded areas, but even in open areas, it's better to be protected. Now, the second, of course, is the physical distancing, which is to maintain about 2 meters of distance, that is 6 yards. But it's not always easy to do so. We know that in crowded places, it becomes difficult. So we try as best as possible to maintain that. But by wearing masks, we are buying a lot of protection. So with masks and hand washing, so that if we are touching something on which the virus might have dropped, by washing hands frequently, we are not carrying the virus from our hands to our eyes or our nose or our mouth. By doing these two things, we get at least 60% protection. So even where the physical distancing of 2 meters becomes difficult, we should try and adopt these methods by which we protect ourselves. So the 6 feet distance, if it is possible, but otherwise at least these two. The other thing, of course, is how do we actually ensure that we recognize the symptoms early? There are a lot of symptoms now, about 11 or so symptoms have been prepared by different agencies. But the most dangerous are, and the most frequent are, cough, which is usually a dry cough, not as much of sputum, but usually a dry cough. Second is fever. Third is breathlessness. Then you can have muscle pains, fatigue, general feeling of malaise. Then you can have sometimes diarrhea. You can have loss of smell, loss of taste, or some chills. All of these have been reported. But the most dangerous, which predict more severe disease, are fever, cough, and breathlessness. So these are the things that we must recognize and promptly report ourselves. Now, of course, the big question that has come up is, how do we test? There are a lot of tests that have been prescribed, and we recognize that the RT-PCR test with throat swab or nasal swab is the common one. Now, an antigen test, which is faster to do, has also been recommended, though it may miss out more cases than the RT-PCR. So it's not that every test, if it is negative, it doesn't mean that you have no infection, because the test may have been done too early or too late in the infection. Therefore, you may still miss out some cases. So symptoms are very important. And if you have fever or cough, then you better isolate yourself, even if the test is false negative. That's what we say. But apart from these two tests, the RT-PCR and the antigen test, which actually look for the virus, the antibody tests are looking for evidence of recent or past infection, which has already produced some level of immunity in the body. And that is being usually used for population surveys. Now, people are talking about herd immunity. So why should we not get herd immunity? After all, this virus will infect many people, and some of them will have problems, but most of them will recover well, because at least 80% of the people recover without much effect. So why not let the virus roam around freely and get herd immunity and protect ourselves? That is one argument. But the problem is, even if 80% do recover without much effect, 20% do get affected, 5% get very seriously affected, 1 to 2% may die, and we cannot allow those numbers to suddenly accumulate, because our hospitals can't cope with that. And secondly, by slowing down the spread of the virus, we may be able to prevent many people from suffering even the serious consequences. We may get more effective drugs or vaccines if we can stall the virus from going around. Now, people who are in farming will easily understand. Fields will require irrigation through rainfall or through irrigation. But that doesn't mean that fields should be flooded. We can't afford the fields to be flooded. So similarly, we cannot allow, on the ground of herd immunity, which is important, it will develop over a couple of years, we cannot allow a flood of cases to suddenly emerge. So that is the common sense that most people who are involved in agriculture will easily understand. So we cannot depend on that only. What about vaccines? There is some promise, but there's no surety, because the vaccine has to be not only effective, and we'll have to see how effective, it has to be safe, and it has to be at least long lasting for a few years at least. Now, we do not know whether we are going to get a very effective vaccine, whether we're going to get a safe vaccine, and whether, because the antibodies now seem to be dropping off in 3 months' time, whether there are other forms of immunity called cell-mediated immunity which last longer. So, how much will the vaccine really protect for how long? We do not know. The vaccine trials are on. We'll know the answers early next year. Till that time, we have to remain protected. And the common sense thing is to remain protected by knowing what works best, which is social distancing or physical distancing of 6 feet, masks, and also protecting the eyes wherever possible with specs or face shields, and hand washing. So these are the things that we need to do. So if we do this, then we can substantially prevent a lot of things. But one of the important things is finding the cases, isolating them at home. People who are affected should be isolated so they don't infect others, but also contact tracing. Because now it is known that this virus can sometimes spread even before the symptoms develop, sometimes even in asymptomatic people. They can be discharging the virus. Normally, we say it only happens when you cough or sneeze, but now it is known that it can happen also if somebody speaks loudly, or sings, or shouts, or sometimes even with deep breathing, where like people have in a gym have exercised a lot, so they're deep breathing, they're panting, so they may bring it out. Now, particularly in a closed area, if you are doing any of these things, then the virus can actually not only as droplets which land on you or land on an object, but they can hang around in the air as clouds, the virus clouds. They're called aerosols. They can hang around for some hours. So that is why in a closed area, particularly if the closed area is air conditioned, there's a greater danger of the aerosols hanging around. So that's why we must wear masks, and we must ensure that we try and keep some distance from others as well, so that we don't form this kind of aerosols, or we don't get exposed to that. So these are important elements that we need to do. And that's why we need to do the contact tracing and isolation also as much as possible, and prevent the spread of the infection. But recognizing that, it is very important now not to depend only on hospitals. Because if many of the cases are mild, and 80% of them appear to be so, then they are likely to be treated at home. They can actually be managed at home. So they actually can afford to be looked after by primary healthcare teams who can visit them, measure their temperature, measure their blood oxygen by fingertip oximetry, and then they can also find out whether their symptoms are improving or not, and then report for testing or any other medical care that's required to the medical authorities. So primary care becomes absolutely important. Now, our primary healthcare teams are good. In Tamil Nadu, I know they are very good, but still, with a large number of other issues also to be dealt with, if the primary healthcare teams are insufficient, then you require citizens also to step in. Citizen volunteers, young persons. It is not difficult to find out about these symptoms of COVID and find out whether you have cough, breathlessness, or fever, or any of the other symptoms. Even a reasonably intelligent person or a 10th class pass student should be able to do that very easily. They should be able to do the finger pulse oximetry easily. They should be able to take a temperature easily. So we need citizens also to participate, even in contact tracing, in trying to find out household surveys of who is having these problems. So unless we get this level of citizen participation, we cannot cover the whole area. We cannot cover the whole community. And we do have to do that frequently, repetitively, because it's not as though the wave of virus will touch a locality once and immediately move away. It may happen that today I may be not having the virus, tomorrow I may go to the market and get the virus. So my house needs to be visited at least once or twice a week. So for all this to happen, citizen participation is important. Second element is stigma and fear. That, oh my God, that fellow has got a virus. There's a dead body with that virus. Papa, the dead person has got virus. So that kind of stigma is not correct. We should not fear and create such fear that people will start hiding their symptoms. So we should deal with much more sympathy and support for the people. For this, citizen participation is important, because if your own local community volunteers are participating in contact tracing or home visits rather than policemen coming and knocking on your door, you are likely to be much more responsive to that. So forming these citizen teams is going to be absolutely critical as well. But recognizing our rural areas need to be protected, can be protected, we can actually resume a lot of economic activities there while they are protected. A good deal of our farming activities have already resumed and they can continue. Our emphasis now, it has to be on health, housing, and education. Education for children should not suffer. As long as the schools are closed, we should look at other means of educating them and try and control the epidemic fast so that we can open the schools. Certainly in rural areas, it should be safer to do it now. So, and food and nutrition are also major priorities. We must ensure that's why rural agriculture becomes a priority, because food security for the whole country in these times is absolutely critical. So, I think we must also ensure that our economic activities are also prioritized to meet our essential needs, and then, of course, some of the manufacturing needs. So, because of these reasons, I believe it's important for people in Tamil Nadu to recognize the importance of personal protection as well as acting in social solidarity as a community in order to do it. So, there are three C's I talk about. One is care, caution, and confidence. Care means you are ensuring that you are wearing a mask, you're washing your hands frequently, you're trying to protect your eyes, and you're trying to maintain a certain degree of physical distancing. Caution means you're avoiding crowds. You are not going to allow crowds to gather everywhere, whether it is in shopping malls or religious places or other social events, birthday celebrations, and marriages. And you will not participate in those crowds. So, those kind of things are cautionary methods. Then, confidence. Yes, by observing these precautions, we can minimize the risk to ourselves and our families. There is no need to fear. There is no need to stigmatize somebody who has the infection. We need to provide them support, and we need to resume some of our economic and social activities with confidence. So, with this care, caution, and confidence, we can fight the virus back. But with carelessness, we'll keep slipping up, and that is what we must avoid. And I'm sure the people of Tamil Nadu have a tremendous amount of good sense to try and beat this virus back. Thank you. I'll be happy to take questions.
Thank you so much. So, clear picture of what is actually happening in the country right now. Before I begin my questions, I have a lot of audience questions coming in. So, Mr. Natarajan wants to know that the patients are being discharged within 4 days from government hospitals, and they've been advised to take treatment from their homes. So, this in two times, is it safe for the patient to be treated at home, and is it safe for the people who are surrounding?
Well, it has been found out that if people have become asymptomatic during the course of hospitalization and have stayed asymptomatic for a couple of days, then a repeat test is not required, because previously it was thought a repeat test is essential. Then it was found out that repeat tests were also giving false positives because of dead viruses. In fact, for some weeks, people were getting positive tests again. Though symptoms had disappeared, they developed antibodies. But in fact, in Canada, in Montreal, for a lady who had delivered a baby, for 55 days, she was not allowed to see her baby or feed her baby because there were repeated false positives. So, based on all this international evidence, it is now felt that you can actually be discharged when you become asymptomatic for some days and you don't need a repeat test. And then the people around the house are not at risk. But even then, because the people around the house are not only exposed to this person, they're exposed to others also, neighbors, and in the market, they should continue to wear a mask. They should continue to keep a safe physical distance. So those precautions will continue anyway.
And one more question is that while comparing our country with the world, with the rest of the world, how are we faring, sir, in handling COVID-19? And Mr. Natarajan wants, especially in terms of the deaths that are occurring per million.
Well, our deaths are much lower in terms of our population. As I said, our death rates are about 20 per million right now.
Yes.
Whereas in other countries now they're crossing 300, 400, 500 deaths per million. So our deaths are much lower, as I said, because of multiple reasons, particularly age and our rural population. But we have to still wait and see, because large parts of our country, rural areas, as well as much of eastern India, are not affected. So we can't take it for granted. But to the extent we are affected, our deaths are much lower. Some people say other reasons also, like BCG vaccination, also previous exposure to malaria and chloroquine, or polio immunization. All kinds of theories are there, but none of them are really proven. Some of them are undergoing testing, like, for example, BCG vaccine is being tested in different countries as a prevention measure. But till we have the results of those trials, we will not know. But whatever the reasons, particularly because of age and a large rural segment of the population, we have greater protection than Western Europe or United States.
Right. Ms. Radhika wants to know, sir, how long can people remain asymptomatic?
Well, people, number of them have remained totally asymptomatic. The question is, some people are, you see, when we say asymptomatic, there are three categories of people. One is people who are asymptomatic at the time of testing. Suppose I'm a contact to an infected person.
Right.
And because I'm a contact, I'm tested. Or I've traveled from abroad from a country with number of cases and I'm tested. But I'm asymptomatic at the time of testing. 4 days or 5 days later, I may develop the symptoms. So, but in the records, I'm listed as asymptomatic.
Right.
Then some are pre-symptomatic. That means you may be asymptomatic now, but 2 or 3 days later, you may develop symptoms. So, and virus actually can be discharged and you can become infective even 2 or 3 days before you develop symptoms. And you do not know when that's going to happen, because suddenly you could be sitting with somebody thinking you're feeling all right. And suddenly when you become symptomatic and start coughing or sneezing, then the other person could get infected. Third, and a sizable number of them, about 30 to 40% at least by most accounts, remain totally asymptomatic. It is possible that some of the minor symptoms like loss of smell or loss of taste or muscle pains may have been ignored, but many of them remain asymptomatic. Generally, young people, particularly in the age group of 10 to 35, are likely to be asymptomatic or very mildly symptomatic. Therefore, some people can remain asymptomatic throughout, and that's why we are doing antibody tests in the population, and we suddenly find to our surprise all over the world that there are a number of people who are testing antibody positive, but they never knew they had the infection.
In the first place. Right. So, Mr. Sudishan wants to know, sir, how long will India continue to remain in this situation? Because we see that a few countries have already recovered from it and they've moved on, right? But we're still in the period of lockdown and we're still trying to combat COVID-19. So, how long is it going to take to come out of this? And what should we do as government to flatten the curves?
See, basically, if you look at some of the countries in Europe, etc., they are pretty small countries to compare to India. Some of them are smaller than our states. So for them to have the epidemic come up in a big way and then go down in a big way was not an issue. But they really peaked fast with a huge loss in terms of deaths as well. In our case, it is more like a slowly progressive wave. It has happened in the big cities. It's now going to the smaller towns. It may enter the rural areas, and hopefully we'll be able to contain it before that happens in a big way. So we have different time calendars in India. It's not one calendar. So we are going to see the epidemic in different places in different time periods. But we must try and prevent it as much as possible from rising into a very big level either in the cities, or certainly we must try and prevent it from creating havoc in the rural areas. So that's going to be our effort. We can't predict the calendar right now, but if we take very effective measures, possibly in 2 months' time, we should be able to see the virus retreating.
Yes, sir. Let's hope that is how things pan out. And we'll move on to the questions about rural India in a bit, sir. before that, there is one more question about why is India not able to ramp up the testing like what South Korea did? Because not from a layman's point of view, we think South Korea is the hero to be followed because of how they contain their virus and everything. But since you're the expert, I'm sure you can shed some more light on how this is maybe or may not be feasible in India.
Okay. Nowadays, films don't have only one hero; they have
Right.
multiple heroes. Okay.
Absolutely.
So let me talk about South Korea and then also talk about Vietnam. See, in terms of South Korea, they produced a large number of kits themselves, testing kits, including these antigen kits, which are now being used in India. And they're very urban population, highly educated population, very mobile population. So they managed to, and they had a culture of wearing masks right from the beginning. From number of years, because of SARS and other infections, they've been wearing masks. The moment they get a cold, they put on a mask. So it was not difficult to control the spread of the virus. Secondly, they managed to go and get tested. Even while driving a car, they would stop and get a drive-in test. But they had the kits available. They were manufacturing them. Whereas in India, not only the kits were not being manufactured, some of the key components required were also had to be imported from abroad. Therefore, we had a slow ramp up of our testing. Now we have the antigen tests also now brought in from South Korea. They're being produced in India with their cooperation. And therefore, our testing has been ramped up. But remember, testing also serves a use not just in doing haphazard testing in mass. It has to be based on some symptoms or some other indications. And as long as those indications are met, you should do the adequate testing. Now,
Right.
Vietnam did not do that much testing. That's the other hero I'm going to talk about. But they got away without even a single death. They got away with very few cases because right from the beginning, they did extensive contact tracing. They went into a lockdown. They shut down their borders, but they did extensive contact tracing. So if you just do only one part of it is testing and leave the other parts like contact tracing and physical distancing and other things, if you ignore them, then you don't achieve your result.
Absolutely. Yes, sir. So that was one of the reasons why our country went into lockdown, isn't it? Sir? So that our not only to limit the spread of the virus, but also to equip our healthcare system so that if and when the cases speak up, our healthcare system doesn't collapse like how it did in certain countries. So is that happening, sir? Is our healthcare system equipped to handle this kind of a pandemic right now?
Well, let us take one fact absolutely as a certainty. No country can develop what we call a surge capacity, an extra capacity to deal with a pandemic, if you don't have a well functioning health system in normal times or in the steady state.
Right.
And you cannot suddenly pull up doctors and nurses out of thin air. You can't pull up equipment and hospitals out of thin air.
Correct.
So you have to have a lot more investment in our health system in terms of health workforce, who are the healthcare providers from primary healthcare to hospital care. You need to have more infrastructure. You need to have definitely more equipment and supplies. So unless we actually, and all of this requires a lot more of public financing. If we spend very little on health, then we'll find that our health system is going to be inadequate in coping with it. So one of the big lessons of this epidemic is India, both at the central government level and at the state level, must invest a lot more in health expenditure and particularly in strengthening the public sector. It is very important. And a very strong primary healthcare is important. If we say 80% of the cases are mild enough to be treated at home, but they need to be monitored at home by a good primary healthcare team, where is our urban primary healthcare? Very feeble. And rural primary healthcare is not very strong either. So we need a very strong primary healthcare-led health system with emphasis on district hospitals, medical college hospitals. So we need to build that up with more public financing and better planning.
Absolutely, sir. So before we move on to discussing more our public healthcare in detail, just one more question. This is something that Ms. Karthika wants to know. So what should be done once the 14 days of quarantine is over? Do we still need to go for an antibody test?
No, not really. Because antibodies also are strange things. They seem to be actually falling down now in 3 months' time. There is something called cell-mediated immunity. You see, and our immunity operates on three things. One is the innate immunity that we have because of good food and good habits. I mean, good food, exercise, not smoking, things like that. They give you that immunity. But the acquired immunity because of an infection has like two Gemini twins. What is called humoral immunity or antibodies. Other is cell-mediated immunity, or which come from T cells, which come from our thymus gland. So these two immunity components are important. The antibodies in this particular case, in some cases, they last lifelong in some viruses. In this case, they seem to be falling down in levels in 3 months' time. So that's why we are not sure about the vaccines and herd immunity. But the cell-mediated immunity, which is also activated, may last longer. But I don't think we need to actually ensure that everybody gets an antibody test because, firstly, antibodies also can be false positive. People who have had other coronaviruses, including a common cold, may get an antibody test positive. There are also other reasons why antibody can be false positive. So that's why even WHO has said you can't use the antibodies as an immunity passport. We are doing antibody surveys to differentiate one region from another region in terms of how much of viral exposure was there, or within the same region between two time periods to see how much of viral exposure has additionally occurred. But to put a stamp on a person as a person who has been infected or become immune, an antibody is not very, very certain.
Okay. So one more question. Mr. Daniel wants to know, are people with neurological disorders more prone to the virus?
Well, there is no immediate evidence of that, but the virus attacks every part of the body, including the nerves. In fact, from the nose, it goes through the olfactory nerve, which carries the sense of smell into the brain, can affect the brain. It can also affect the brain through other means. It can cross the blood-brain barrier. And viruses are also known to affect nerves elsewhere in the body. Since every part of the body has a blood supply, this particular virus doesn't stay in the lungs or in the respiratory tract. It goes and spreads along the blood vessels. And so the more damage your blood vessels previously, the easier it is for the virus to spread along or to take up residence there. So virtually every single organ in the body can be affected. And the nerves also can be affected because they're also supplied by the blood. But also one more thing, because the virus produces an inflammatory reaction in the body. And therefore, the body's response itself can also injure different organs, including the nerves.
Okay. So while we understand that building up our immunity does not happen overnight, but we do, that is the first thing our mind goes to when we're dealing with something this mass. So what are the little steps that we can take to safeguard ourselves against the virus in terms of the food we take or?
Well, basically, our immunity is substantially dependent upon a number of good foods that we eat. Fruit and vegetables are particularly important because they give you a lot of good antioxidants and vitamins, which are very critical. Protein is also important because your antibodies are made up of protein. So, good vegetable protein, particularly, and also if you take a lot of fruit and vegetables, that is going to be very protective for you.
Okay. So one last question before we move on to the public health discussions. I'm sorry. Just one question. Tapas wants to know if this one person is affected by the coronavirus and recovers, is it possible for him to be affected again since the antibodies kind of like drop down after 3 months or so?
This is a million-dollar question now because whether it is herd immunity or vaccines, if a person's immunity is only going to be lasting a few months, then we are in trouble. On the other hand, if it lasts for some years, it's okay. Now, if some coronaviruses cause common cold. Now, you know that a person can get cold twice a year, right?
Absolutely.
It doesn't necessarily mean that a person won't get it for 2 years later or so. So we do not know about this virus. we still have to wait and see. There are some case reports of reinfection, but some cases which were considered to be reinfection because of tests were found to be false positive tests because of dead viruses. But genuine reinfection also has been reported. So is it because of immunological deficiency or because the immunity tends to drop fast? We still do not know, being a new virus. We are hoping that even if the antibody levels drop, the cell-mediated immunity component lasts longer and will give us much longer protection. We'll know soon.
Absolutely, sir. So whether or not we're affected by the virus, I think it's of utmost importance to take all the measures necessary, like we're practicing social distancing and washing your hands and wearing masks, etc. It's also, I think it's time to move on to the rural section of the interview, sir. Sorry. So we've seen how our country has handled cities and towns, and if and when the infections hit the rural areas, especially because the migrant workers who are working in the cities have all gone back to the villages, to their hometowns, and they're in the hotspots. All the metros being supremely affected. With these people, they might act as asymptomatic carriers, or maybe even they were affected and the disease from here to there. What is going to be the state of our country in the near future?
Well, I have always maintained that the migrant workers should have been assisted in getting back to their homes as soon as the lockdown was announced.
Right.
Because the nature of their work and the nature of the places they stayed in the big cities would not have exposed them to the foreign returning travelers or their household contacts and others.
Right.
And they would have gone back without causing any harm in the villages. But now that they were confined to the cities for quite some time and then were permitted to go, some of them would have carried the virus. How many, we cannot say. Not too many, but some of them would have. But if they were also tested before leaving, if they were tested after arrival, if they were quarantined in the village or near the village, then the risk would have been substantially reduced. But that is why we need this kind of symptom-based syndromic surveillance of households. So if you have primary healthcare team functioning well and you go to every house and then ask every day, is there somebody with a cough or a cold or a fever or a breathlessness, and then immediately test. Testing means even to test with a thermometer or an oximeter should not be difficult in a village. You may not have immediately an X-ray machine available. So these are the kind of things that could be done in order to isolate people fast. So we need to prepare ourselves, our primary healthcare system, and the community volunteers for this.
Yes, sir. So, talking about our primary healthcare centers, we all know that our hospitals are not that great, especially in the rural areas. We are often understaffed or we don't have the proper equipments. So, if we are going to deal with this pandemic, what are the measures that the government should take, not just in terms of educating the people, but in terms of equipping the primary healthcare centers so that we can handle this with little to no casualties?
Well, as I said, right now we have to take some emergency measures. We must improve whatever, to the extent we can, we must improve our primary healthcare centers. And because we cannot suddenly create new nurses and new doctors and new facility, new hospitals there or new primary healthcare buildings there, use whatever you can to the maximum extent, but train a large number of community volunteers. Many of these primary healthcare services can be done, particularly for COVID, without much of medical knowledge. So people can be trained to do that. So we must use the strength of our communities to combat this COVID. So try and do that. And of course, even in terms of healthcare facilities, I keep saying, if we can create tent cities for melas and religious festivals, why can't we create a tent city near a couple of villages if required? I mean, all those things have to be planned out.
Mm.
But
Yes, sir.
basically, as much as possible, try and do it through our primary healthcare teams with citizen volunteers.
So with almost our healthcare sector being like 80% privatized, do you think it is time we expand the public private partnership and ensure even the private players come in and poor people out?
See, we must use all our societal resources, whether it is public, private, or voluntary NGO type organizations, to the best of our advantage. However, if you have a weak public sector, you will never be able to set the terms to the private sector.
Yes.
whether it is cost or somebody say, I need to charge this much for testing, I need to charge this much for treatment, I will not admit these patients because my other patients will suffer. So these kind of things will always happen in a private setup. So you must have a strong public sector which can then draw upon the private sector to partner. So without that, the private public sector and the government will be at the mercy of the private sector. Some of them will extend very good services on their own. Many of them may not. So in order to even have a good negotiating position, you must have a strong public sector. So that is very
Absolutely.
important.
Absolutely. That was going to be my next question. In terms of the public service in public sector infrastructure in our country, what would you propose as the ideal sector? So since we've learned that it's not quite near what it should be, what do you think should be improved? What are the specific sectors?
In terms of healthcare,
Healthcare, yes, sir.
well, primary healthcare is something that needs absolute priority, then district hospitals, then medical college hospitals. We must ensure that there is a good linkage between primary, secondary, and tertiary care in both directions so that people are referred when necessary without delays and they return back for continuity of care in the primary care. So all of these are going to be absolutely important. We need for primary care a large number of technology enabled non-physician healthcare providers. We don't need too many doctors there. Some doctors may be required in primary healthcare centers and community health centers, but certainly in sub-centers you can manage with technology enabled primary healthcare providers who are not necessarily doctors, nurse practitioners and others as well. But while you're doing that, you must also ensure the essential drugs are in good supply. We had prepared a report for the Planning Commission in 2011 as a framework for universal health coverage, in
Yes, sir.
which all of these measures were listed, how to strengthen our healthcare system. Some of those elements are there in the National Health Policy of 2017, but they need to be implemented much better. But all the good ideas will not be implemented unless the governments are willing to put in more money behind it. So
Absolutely.
you need more money, but at the same time, better spending of that money. So for more money for health and more health for the money.
Absolutely, sir. So, what do you think is going to be the new normal, sir, especially in the villages? Because if one person in a village is affected, to access proper health care, he has to travel miles, often by public transport, and if that is missing, it's going to pose another problem. So, how do you think we can combat this situation?
Strengthen your primary healthcare centers and community health centers much, much better so that nobody should be able to travel too far for getting essential health services. Because then strengthen your district hospitals. Preferably try and link up a district hospital to a medical college and nursing college and for training allied health professionals. So one district or two or three districts together must have that nodal center and they must all be linked together and a good transport service for emergency medical transport. But unless you move the facilities as close to home as possible, you're not going to meet this thing. So the most important thing is primary health care. But the other things also need to be strengthened in a well-linked fashion.
And are we, as a country, doing this for Corona, sir? What are the steps the government is taking to safeguard our villages?
Well, right now, in terms of Corona, people are trying to do lots of things, but you cannot create a new healthcare system overnight. But this is a lesson that I think every state government and the central government should register, that you have to invest much more in health. But as I said, right now, while they are doing things, they are short staffed. So that is where citizen participation comes in. And without, that's why I say people partnered public health. So bring that concept in, try and get citizen volunteers to help, and we'll try and tackle this together.
Absolutely, sir. So one more question, sir. Some states who were very efficient in containing the virus and in combating the spread are now saying that they are facing the second spread of the virus. So if this is the case, then what happens if the second spread starts in states that have not even contained the first wave? So what is this myth? How are we going to handle this, sir?
Well, we do not know whether there is a second wave or an incomplete first wave. We do not
Okay.
know because it's a carelessness. For example, some places like Bangalore, which did very well, suddenly it's like exams are over for students, and students start jumping around and dancing. So they thought that it was over, and then suddenly all the cautionary measures were relaxed. So, I mean, then you have all kinds of birthday parties and religious events and everything happening, and shopping sprees and so on. So, it is not the second wave, it is still the continuation of the first wave.
Okay.
Therefore, we have to make sure that we contain the first wave very well, but prepare the health system in such a manner that it can combat the second wave and put it down as quickly as possible. So the lessons of the first wave must be put to good use for the second wave if it should happen.
Right. So one question from the audience is that are our epidemiologists not being utilized to their maximum capacity? And I would like to build up on that and also ask you about how are the testing facilities the research facilities in the country, sir? Is it up to the mark?
See, firstly, that question of whether they're being used adequately or not should be directed to the government's concern. I cannot answer on behalf of the governments. Right. But I believe we require a larger number of people. People who are there must be utilized much better. But we require many more people trained in public health. Public health has been neglected. That's why in the Public Health Foundation of India, too, we started public health institutes. Now, medical colleges also should play a greater role in training more public health people, including people who are specializing in epidemiology.
Yes.
The universities, because public health is not only medical, public health has multiple disciplines. And it has social sciences, it has biological sciences, it has quantitative and statistical sciences, it has health economics. There are so many things that are there in that. Anthropology, behavioral sciences, demography, name it. There are so many sciences. So universities must also play a greater role in training people in epidemiology as well as in other areas of public health. So we do need much more, but we need public health cadres. Even if you train these people, where are they going? If the governments do not create jobs for them in their health services, where will they go? They'll go abroad, or they'll go to some research NGOs, but they'll not be available easily. So I think creating public health cadres is going to be very important for every single state, and creating opportunities for people with public health training to be appropriately utilized, not just training, but also give them the right kind of responsibilities and roles. So that is going to be a very important priority as we move along.
Yes, sir. So, given that we've faced this kind of a pandemic and we kind of are now aware how our system is and how equipped we are in terms of how we are handling this pandemic, do you think in the future the need for this public, as you said, health increasing the cat, is it going to happen anytime soon? Are we seeing any strategical planning in terms of from the government side for this as an immediate measure?
Well, if you look at the national health policy also, they said public health cadres are required, public health management cadres, they said. Even last year, there was some announcement it should be done. But unless the center and the states both decide that this must be done, it won't happen. You need a combination of political will and professional skill for these
Right.
cadres to come alive.
Absolutely. So we can see that the experts are talking about this. I have been talking about this for the longest time now. It's there in paper. It's just that we really need to buckle up and actually do it in action. So one more question from a couple of audience. Investing a lot of money for infrastructure and having except like possible for the private sector and public sector. So why is it not possible to ensure the presence of doctors in primary healthcare centers?
See, firstly, you must create facilities which give people work satisfaction. The facilities must be adequately equipped, a reasonable amount of social amenities also provided, and then you attract people. Then you have a rotational system so that if I know that I'm going to be there, I'm going to be transferred out after 3 years, I have some educational opportunities or career development opportunities. So all of these incentives will have to be provided, not just financial, but also non-financial incentives.
Absolutely.
We had done that as Public Health Foundation of India, partnering with UNICEF for government of Chhattisgarh about 4 years ago. when we actually, for some of the districts which did not have primary healthcare center doctors, or even in district hospitals, they didn't have doctors, we created a set of both financial and non-financial incentives into one package. And when they implemented it, doctors came from different parts of India. So it's a question of trying to prepare the right kind of package. No doctor wants to go where he feels useless without equipment or ability to, or without medicines, but also some degree of minimum social amenities. These are required. And your transfer policies will have to be transparent. If you have to bribe every time to go to a different place, then that's not attractive for government service.
Absolutely, sir. So we were talking about doctors and how the procedures has to be for them. In terms of the equipment and the medicine, how well equipped are we? And what is your recommendation, sir? Right after we deal with this, if we are going to create a revolution in our public healthcare system, how well equipped should one particular healthcare center of a particular village or a hamlet should be?
See, there are different standards for primary healthcare. We can certainly improve upon them, and we must attain those minimum standards that have been set by the National Health Mission, but even go beyond them, because things are changing now. A lot more new technologies are also available, which are simpler but more efficient. So we need to revise those guidelines and then get the things done. But also, we recognize that some of the hospitals in the big cities are better equipped, but most of them are in the private sector. Large government hospitals were neglected. I mean, when we were all medical students, it was the large government hospitals which made us doctors. And even most of the doctors who are now in private hospitals trained in government medical colleges. So the thing is, we cannot continue to neglect the public sector. We have to put in more money into the public sector and also invite the private sector to join in a responsible manner. So I say the public sector has to be more responsive, private sector has to be more responsible, and the voluntary sector has to be more resourceful.
Yes, sir. I think we're almost done with the time, sir. So would you like to give closing remarks, please?
Well, I think COVID has taught us many things. One, of course, is that we need a much stronger health system. We need people-partnered public health with a lot more citizen participation. And we need decentralization of decision making. Everything can't be done at the central level. It has to be decided not only at the state level, but at the district level. You have to take the local specificities into consideration, the rural area versus urban area, etc. But important thing also is that these viruses don't just happen to come in because they fancy us. They come from the wildlife, because we have created conveyor belts for them to come from wild animals to captive veterinary animals and into human habitat. So we should change our way we deforest and create this kind of conveyor belts. So our developmental patterns will have to change. Our food patterns will have to change if we have to avoid this kind of zoonotic pandemics. So it's not just vaccines and drugs that we have to depend upon. We have to look at ourselves and see what are we doing to prevent these pandemics in the future.
Right. It's just not going to be an immediate measure that we take or a knee-jerk reaction. It has to be like one is the lifestyle change that all the public has to take. And as you said, in terms of the policy making and funding, the government has to really buckle up. And this also has to be like a long-term measure.
One more message.
Yes,
why
sir.
is it that people with hypertension, diabetes, and people who are spoiling their lungs with smoking more likely to get severe COVID and die of COVID? So should we not prevent these diseases as well?
Yes, absolutely.
So not only COVID, any other viral influenza can also kill such people more. So it is important for us to prevent these diseases as well. That is another lesson, not just look for vaccines afterwards.
Yes, sir. So as a community as a whole, I think we should make the decision to be more healthier, lead a more healthy lifestyle, so that we don't depend on the healthcare system to treat the diseases. I think prevention is absolutely better than cure. Thank you so much for joining with us today, sir. It was an absolute pleasure having you, and we hope we hope some of the measures that you suggested today get implemented, so that we have a better healthcare system at large, especially for the rural people. Thank you so much, sir.
Thank you. Because I was born in Tamil Nadu, I consider myself half a Tamil. நான் சென்னை பிறந்த காரணத்தால் பாதி தமிழம்.
நன்றி சார், இணைந்ததற்கு நன்றி நேயர்களே. Maiam Talks நான் உங்களை சந்திக்கிறேன்.
Bye then. Vanakkam.